All right, let's dive in. Today, we're going to decode one of the most amazing conversations that's happening inside your body, like right now. The one between medicine and you. I mean, have you ever really thought about that? You take this tiny pill, and somehow it just knows where to go. It's like it has a GPS for your body. It's not magic, though. Nope, it's something way cooler. It's a masterpiece of molecular engineering. And today, we're going to pull back the curtain and see exactly how it's done. Okay, so to get this, we've got to start with a really simple but super important idea. Think of it like a molecular handshake. The whole secret is about a perfect fit. And this idea, as simple as it sounds, is so powerful. See, your cells are just covered in millions of these tiny molecular locks. We call them receptors. And every drug is basically sculpted to be the one perfect key for a very specific lock. It's why, a headache pill doesn't suddenly make your big toe feel weird. It's because that key is only looking for the locks that are involved in pain signals. Pretty smart, right? But here's the thing. Just fitting into the lock, that's not the whole story. Not even close. The key actually has to do something. It has to start a conversation with the cell. And it turns out there are really two main messages a drug can send: on and off. So first up, we've got the agonists. Think of an agonist as the perfect key. It slides into the lock, it turns, and bam, it flings the door wide open. It hits that receptor and basically yells at the cell, go, do your thing. A great example is an asthma inhaler. That drug is an agonist, and it tells the muscles in your airways to chill out, to relax, and that opens them right up so you can breathe. It's the ultimate on switch. And then on the flip side, you've got the antagonists. Now this key also fits the lock perfectly, but it's a dud. It doesn't turn. It just sits there, taking up space. Its whole job is to physically block your body's own natural key from getting in. This is your cellular off switch. You see this a lot with blood pressure meds. They're antagonists that block the receptors that would normally tell your blood vessels to tighten up. With the blocker in place, they just relax, and your blood pressure goes down. And believe it or not, it gets even more clever than that. There are two main ways to block that lock. First, you have your competitive antagonist. It basically gets into a direct fight for the keyhole. If you have enough of your body's natural keys floating around, they can eventually muscle the blocker out of the way. But then there's the uncompetitive antagonist. This one is way sneakier. It doesn't go for the keyhole. Instead, it binds to a totally different spot on the lock, and in doing so, it actually changes the shape of the keyhole. So now the real key can't fit, no matter how many of them show up to the party. Genius, right? Okay, so we get it. Drugs can turn things on or off. But how do scientists know if a drug is actually good at its job? Like, how do you score its power? Well, this is where we shift gears from biology to some cold, hard numbers. The first big idea here is potency, and all that means is how much drug do you need to get the job done? A really potent drug can have a massive effect with just a tiny, tiny dose. And why does that matter? Well, it's a huge deal. The less drug you need, the lower your risk of side effects. Plus, it can make the medicine easier to take and even cheaper to make. So high potency is a win-win-win. So, how do we actually measure this for a blocker-type drug, an antagonist? We use a score called the IC50. Now, that sounds super technical, right? It just stands for Inhibitory Concentration 50. But all it's really asking is a simple question. How much of this drug do we need to shut down half, 50%, of what it's supposed to be blocking? And here's the key takeaway. A lower IC50 score is better. It means your drug is crazy powerful. Okay, look at this number, 1.2 nm. That nm stands for nanomolar, which is, well, it's a ridiculously small amount. It's almost impossible to imagine. So let's try this. A 1.2 nanomolar concentration is like taking one single sugar cube and dissolving it in an entire Olympic-sized swimming pool, and even with that tiny amount, the drug still works. Now that is what high potency looks like. So let's make this super clear. Let's say we have drug A and drug B. Drug A has an IC50 of 10. Drug B has an IC50 of 500. Now remember the rule, lower is better. That means drug A is just way more powerful. In fact, it's a whopping 50 times more potent. You'd need 50 times more of drug B just to get the same exact effect as drug A. It's no contest. All right, a drug can be the most potent molecule in the world, a total rock star. But you know what? If it's not safe, it's completely, utterly useless.
And this brings us to what is, without a doubt, the most important step of this entire journey, the safety checklist.
This quote just hits the nail on the head. Do no harm. That's the first rule. Safety pharmacology is basically the bouncer at the club. It's the gatekeeper. It's a whole series of intense, you don't get to skip this tests, designed to put a drug through its paces and see if it has any nasty side effects on your body's most important systems. It's how we make absolutely sure a new medicine is actually going to help, not cause a whole new set of problems. And listen, every single potential drug has to go through this core interrogation. There are no exceptions. Scientists check everything. The central nervous system. Does this make you dizzy? Does it mess with your coordination? Then, the cardiovascular system. What's it doing to your heart rate, your blood pressure? And of course, the respiratory system. Can you still breathe normally? Only, and I mean only, a drug that aces all of these tests can even think about moving on to the next stage.
So let's zoom out and put all of this together. We've gone from this simple, elegant idea of a key fitting into a lock all the way to this super complex and absolutely critical process of making sure a medicine is safe.
Okay, so if you're going to remember just a few things from our chat today, let it be these. 1. Drugs are like super specific keys for molecular locks in your body. 2. Agonists turn things on, antagonists block them off. 3. A drug's power score, like that IC50 number, tells us how little you need to get the job done, and lower is better. And finally, and this is the big one, nothing, absolutely nothing is more important than that safety checklist that keeps us all safe. It's just such an incredible field of science, isn't it? And it's moving so fast. Being able to design these molecular keys with this level of precision, it's already changing the world. It really makes you wonder, right? What new doors are we about to unlock? What diseases are we going to be able to tackle next? All because of the keys we're designing right now. It's an exciting time. Thanks so much for diving into this with me.